besides being an alternative healer in alternative modalities and acupuncturist, he's also an expert on Chinese medicine. He's an international superstar in martial arts. You may not have known that, and you can do that. And he's a New Jersey transplant, which I think is a good thing. But what really sets him apart is not only his expertise in acupuncture and in supplementation, but he brings a commitment to integrating Eastern and Western medicine that you don't usually find in other practitioners. So why don't you lay a groundwork first about explaining in a shorter version, Chinese philosophy of Chinese medicine.
Sure.
Okay.
Well, Chinese medicine has a written recorded history of about 2,500 years. And that was first written with the Huangdi Neijing, which is the Yellow Emperor's classic to internal medicine. It was the first book written on internal medicine in the world and is still continually used today in medical practices. And some experts say Chinese medicine dates back as far back as 8,000 years. Now, that being said, today, going forward, what we see is a lot of the history and the metaphors and the poetry that they observed in nature and to define physiology and how disease patterns work in the body, pathology. They would use terms such as wind and dampness and qi and yin and yang. We now see in Western medicine and neuroscience parallels, and it completely brings them together.
Why don't you lay a groundwork for describing why supplements, why vitamins, why herbs?
Great question.
Because many of us grew up, we knew about vitamin C, and people talk about it now, but it's always a controversial topic.
Sure. Well, it's a very large market right now. It's $1 billion industry. And in the 1990s, the FDA passed an act because they did not want to get involved in regulating the industry because it's so big. In saying that, supplements with research now, it's biochemistry. It really is. And what's unique about it is when you understand how to apply these nutraceuticals and these vitamins and supplements and herbal formulas, you can really change someone's biochemistry. So if you're treating hypertension or diabetes or migraines or any type of chronic pain or mental illness, depression, anxiety, you can really treat this with supplementation that you're not going to get in food because of the large amounts of dosages that you need.
Okay, so let's say I come in and I say, I have migraine headaches. Why would I come to you?
So in Chinese medicine, we use the 4 pillars of diagnosis, which basically helps us to assess the whole body together. We listen, and that includes listening to the voice, the strength of the voice. We observe the color of the face, we observe the tongue, we look at the tongue body, the coating. We feel, we palpate the pulse, the radial pulse.
Show them what a palpate.
So if I'm checking the radial pulse in Chinese medicine, which is really unique, is that by feeling the radial pulse here, I can actually, kind of gives me like an MRI scan of the internal structures of the body. On the left side, we have the heart, the liver, and the left kidney or the reproductive organs. And on the right side, we have the lung, spleen, or digestion, and then the right kidney or the hormone levels. And depending on the depth of the pulse, right, the quality of the strength of the pulse, the size of the diameter, gives us a understanding of how that organ is functioning. So classically, traditional Chinese herbology was made as decoctions, and actually they were also made in pills. So in my many books of herbal medicine and formulas, what we would find is that they would describe how to make these decoctions. And either you would boil them down into a tea and drink the tea, 3 cups a day, or you'd grind them into a powder, make little pills. Nowadays, for convenience sake, either I get organic herbs and give them to my patients if I want them to make the tea, which is very strong, and the decoction tends to be more stronger, more powerful. However, they have concentrated granules now, which I use all the time in my clinic. They're very effective, they're clean, they're high quality, and they're very strong. And it comes in a nice powder form, easy to take, just scoop it out, mix 3 scoops, mix it with a little water. I always tell my patients, you're doing a shot, you're not sipping wine, because it might not taste the best, but just get it down and just shoot it down and drink it, okay? Depending on the age of the patient, if we're looking for brain health, again, there are certain nootropics, which are compounds that keep the brain healthy, okay? There are supplements like that I would recommend for that. A good fish oil is always simple and easy to get, and it's safe to use. Fish oils are also good because they thin the blood a little bit too. So it's good for the heart and prevention of stroke. Just you don't want to mix those with any type of blood thinners that you may be already on, right? You don't want to mix ever that at all. And then a good multivitamin. I don't recommend anything you buy over the counter though, because most of them tend to go right through your system. They don't get too absorbed, too available.
So, we're leaving here. What do we need to take out of this in terms of what we can use in our own lives going out as just a way to approach the whole issue of health and establishing a foundation for our health?
Balance and harmony. Balance and harmony. Keep everything in balance, particularly your emotions. And when it comes to supplements, be wise. Find someone that's a good practitioner, and you don't need handfuls of supplements. I don't believe in that. I really don't believe in that. But when it comes to just living a long, healthy life, keep it simple, Good food, exercise, sleep well, smile a lot.